You can get us going, please.
This is yours.
Okay, we're right on. Yes, thank you. Thank you. All right. Good evening, and I want to thank the committee for your patience. And this is going to happen because we need to get ourselves ready. So thank you for your patience, okay? You can feel, you have permission to put lousy music like I did. Okay, so this is voting list number 7. And we have, 1 second. We have 6 withdrawals. It's been moved in second. Any concerns or questions or objections? Seeing none, all those in favor say aye. All right, any objection? See none. All right, so let's go on to the first bill. This is the one that I have. Let's do, okay, let's do House Bill 97. Delegate Taveras and Pastor, baby food, toxic heavy metals, testing and labeling. It came out of committee, and it was Aaron and Bagnall.
There's an amendment, reprint of the bill in your packet beginning on page 9. The bill as amended provides that on or after January 1st, 2025, a person may not sell, distribute, or offer for sale baby food in the state that contains toxic heavy metals that exceed the limits established by the U.S. Food and Drug Administration. And then beginning January 1st, 2025, each manufacturer of baby food shall test a representative sample of each production aggregate of the manufacturer's final baby food product for each toxic heavy metal. The bill also provides that on the request of the Department of Health, a manufacturer of baby food must provide the results of the testing conducted under the bill to an authorized agent of the department. Beginning January 1st, 2026, each manufacturer of baby food must make publicly available on the manufacturer's website for each baby food product sold, manufactured, delivered, held, or offered for sale in the state, the name and level of each toxic heavy metal present in the final baby food product, and sufficient information to enable consumers to identify the final baby food product, and a link to the U.S. Food and Drug Administration's website that includes the most recent U.S. Food and Drug Administration guidance and information about the health effects of the toxic heavy metals on children. If the baby food is tested for a toxic heavy metal that's subject to an action level by the U.S. Food and Drug Administration, they must include on the baby food product label a certain statement and a QR code or other machine readable code that allows consumers to access on the manufacturer's website or the baby food product information page the test results for the toxic heavy metals, and a link to the webpage of the U.S. Food and Drug Administration website that includes the most recent guidance about the health effects of toxic heavy metals in children. If a consumer believes, based on the information gathered through the use of the QR code, that the baby food is being sold in the state with toxic heavy metals that exceed limits established by the U.S. Food and Drug Administration, the consumer shall report the baby food to the Department of Health.
After all of that, you don't have any questions, right? Okay, so Delegate Bagnall.
So the amendments conform the bill to the California law, which removed any opposition, and it passed unanimously. I would move the amendments.
Second.
Is it moved in second? Any questions or concerns regarding the amendments? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none, it passes unanimous. Who does not want to be on the bill? Okay. Everyone wants to be on it. All right, let's go on to House Bill 850. And can you, yeah, we're gonna leave it for later. We don't want the mood affected. Let's just hold on a minute. So 850, and that came out of committee favorable with amendment. It was Lindsay and Kurt. Lindsay.
This bill expands the small business preference program to all executive branch units and agencies, but repeals its application to the University System of Maryland and Morgan State University. It requires the Board of Public Works to implement and oversee the program. The bill also allows agencies to apply the value of all contracts, not just designated ones, including small business preference contracts, toward meeting the 15% set aside goal established under the Small Business Reserve Program. The amendments in your packet that are on page 12 Specify that each unit, rather than the Board of Public Works, may designate certain procurements for the Small Business Preference Program with the approval of the head of the unit. Authorize a unit to apply any contract awarded to a small business toward the 15% objective, even if the procurement is not designated for the Small Business Preference Program or the Small Business Reserve Program.
Thank you, Lindsay. Delegate Kerr.
There were no issues in subcommittee. I move the amendments.
Second. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any objection? Seeing none on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any objection? The bill passes, is unanimous. Let's go on to how. Oh, for this one, who does not want to be on the bill? Okay, thank you, Lindsay. 934, Delegate Hutchinson, favorable with amendment out of committee. It is Lindsay and Rosenberg.
As introduced, this bill would have generally required a person to be licensed by the Maryland Board of Physicians before practicing limited licensed radiologic technology in the state, establish licensure requirements, and apply existing statutory provisions for the practice of radiation therapy, radiography, nuclear medicine technology, and radiology assistance to the practice of limited licensed radiologic technology. The amendments that begin on page 13 in your packet alter the short title of the bill, strike the bill as introduced, and instead alters the X-ray duties that an individual may perform without a license in accordance with regulations adopted by the Board of Physicians, and alters the circumstances and required training to perform those X-ray duties, requires a physician's office to ensure that all requirements are met for each X-ray exam performed, and establishes civil penalties of up to $5,000 for each violation on the physician's office and $1,000 for each violation on the individual who committed the violation.
Okay, Delegate Rosenberg.
Thank you, Madam Chair. This bill as amended would be conformed to the Senate cross file as amended. That bill passed the Senate on second reader today. The vote in subcommittee was unanimous, and kudos for bringing this about. Go to the sponsor of the bill, Delegate Hutchinson.
He did a lot of work.
Favorable on the amendments.
The amendments have been moved in second. Any questions or concerns on the amendments? Seeing none on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any objection? Seeing none, the bill passes unanimous. Who does not want to be on the bill? On 934. Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Kipke, Delegate Kaiser, and Delegate Riley. Okay, thank you, Delegate Hutchinson, for doing a really great job. House Bill 962, State Procurement Small and Minority Business Reserve Program. It was favorable with amendment. It is Lindsay and Kurt. Lindsay.
As introduced, this bill would have renamed the Small Business Reserve Program to be the Small and Minority Business Reserve Program and require that state procurement units, to the extent practicable, structure their procurement procedures so that a minimum of 10% of the total dollar value of their contracts is made directly to certified minority business enterprises. The amendments that begin on page 33 in your packet adopted in subcommittee strike the bill as introduced, alter the short title of the bill, and instead increase the participation goal for the Small Business Reserve Program from 15% to 20%. Authorize a unit to apply toward the unit's overall annual Small Business Reserve Achievement Awards made to a small business under a designated small business reserve contract, as well as awards made under a non-designated small business reserve contract, and requires MDOT in consultation with GOSBA to develop an outreach program to increase the participation of small businesses that are owned by economically disadvantaged individuals participating in the Small Business Reserve Program, and submit a report on or before December 1st each year to BPW and the LPC. And it alters the reporting requirements related to the Small Business Reserve Program to reflect awards made by units rather than payments.
Delegate Kerr.
Really no issues in subcommittee, so let me move the amendments.
Was it unanimous?
Was unanimous, yes.
Okay, the amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none on the bill as amended. Any discussion or concerns? All those in favor of the bill as amended say aye.
Aye.
Any objection? Seeing none, the bill passes. Who does not want to be on the bill? Okay. The House Bill 969, And that is death certificate, cause of manner of death determination, requirement after change of correction. It came out favorable with amendment, and the analyst is Aaron and Bagno. Aaron.
The bill requires a medical examiner if the cause or manner of death on a death certificate is amended or corrected to be undetermined or homicide, to provide notice to the state's attorney and local law enforcement where the body was found of the different finding or conclusion on the cause or manner of death. An assistant state's attorney with knowledge of the case in which the victim's cause or manner of death was amended or corrected must meet with a person in interest regarding their request that the office of the state's attorney pursue an investigation into the circumstances of the victim's death. There are amendments on page 42 of your packet that were adopted in the Public Health and Minority Health Disparity Subcommittee that provide that if a law enforcement agency is notified by a medical examiner under the provisions of the bill, they must reopen or reinvestigate an investigation involving the death of a victim whose cause or manner of death was amended or corrected to be undetermined or homicide, and may not close a case that was reopened or investigated until at least 20 years after the law enforcement agency was notified.
Delegate Bagno.
Thank you, Madam Chair. So we had a great conversation. The bill sponsor worked with judiciary, worked with state's attorney's office. Claire, we had a question about whether or not the Office of the Public Defender was involved. They're not involved in this process. There was also a question about whether this would open up a lot of investigations, and we clarified that you have to actually win an appeal, and this would have applied to about 6 families last year. And with that, it passed unanimously, and I would move the amendments.
Second.
The amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? The bill passes unanimous. Who does not want to be on the bill? All right, let's move on to House Bill 981, Maryland Department of Disabilities. It was favorable with amendment. Lindsay and Kurt. Lindsay.
As introduced, this bill requires the Maryland Department of Disabilities to fully implement by July 1st, 2025, statutory provisions that require certain reasonable steps to provide equal access to public services for individuals with limited English proficiency. The amendments on page 47 in your packet were adopted in subcommittee that alter the short title of the bill and add existing principal departments to the provision requiring compliance by July 1st, 2025, and add a provision requiring new principal departments created on or after October 1st, 2024 to comply 1 year after they are created. The existing principal departments that aren't otherwise included now under the limited English proficiency services provisions, in addition to Department of Disabilities, are MDEM, Department of Service and Civic Innovation, DBM, DGS, Do It, and Planning.
Thank you, Lindsay. Delegate Kerr.
There were no issues in subcommittee. We moved the amendments. It was unanimous.
The amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none on the bill as amended. It's been moved in second. Any questions or concerns? All right, all those in favor say aye. Any opposition? Seeing none, who does not want to be on the bill? All right. House Bill 1048, it came out favorable with amendment. It's Behavioral Health Advisory Council and Commission on Behavioral Health Care Treatment and Access Alterations. It was favorable with amendment. Aaron and Bagno. Aaron.
This is a departmental bill that requires the Behavioral Health Advisory Council and the Commission on Behavioral Health Care Treatment and Access to work in conjunction with one another, including by coordinating with one another on their annual reports and meeting jointly at least 3 times per year at mutually determined times and places. The bill alters the membership and terms of the council and requires the commission to make specified recommendations regarding the integration of somatic and behavioral health services in Medicaid. There are amendments on page 50 of your packet that conform the House bill to the Senate crossfile and also add the Secretary of Aging and a representative of the Maryland States Attorneys Association to the Commission on Behavioral Health Care Access and Treatment.
Delegate Bagno.
Thank you, Madam Chair. So we had a great conversation about this bill. There was a question about whether or not the Office of the Public Defender should be on it. They were already a stakeholder. With that, it passed unanimously, and I would move the amendments.
The amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none on the bill as amended? It's been moved in second. All those in favor say aye. Any opposition? It passes unanimous. we cannot get on it because it's a departmental bill, correct? All right, so let's go on to House Bill 1074, Health Insurance, Mental Health and Substance Use Disorder Benefits. It was favorable with amendment out of the subcommittee, and the analyst is Lisa and Carlson, the chair. Lisa?
This bill requires carriers to submit reports demonstrating compliance with the Federal Mental Health and Addiction Equity Act. The bill alters the contents of the reports and specifies that a carrier has the burden of persuasion in demonstrating compliance. The insurance commissioner must review a specified number of non-quantitative treatment limitations, or NQTLs. And the bill also establishes additional penalties for non-compliance with the Parity Act. Amendments start on page 55 of your packet, and there is a reprint on page 64. Amendment 1 makes the bill an emergency and makes technical changes. Amendment 2 requires carriers to identify and perform a comparative analysis on all NQTLs. The amendment also adds a definition of product and provides that carriers must report to MIAA on at least 5 NQTLs for each product rather than all NQTLs for the 5 plans with the highest enrollment every 2 years. In addition to the reporting requirement, the amendment requires carriers to provide an analysis within 15 working days of a request from the commissioner and 30 days of a written request from a member. Amendment number 3 specifies the factors the commissioner should consider when determining which NQTLs to select for a reporting period, and requires reports to include a specified attestation and additional analysis under certain circumstances. The amendment also specifies that carriers are required to perform analyses for NQTLs used before the enactment of the Parity Act. Amendment number 4 requires the commissioner to develop templates for carriers to use when submitting comparative analyses and corresponding data. Amendment number 5 authorizes the commissioner to require carriers to complete data templates for NQTLs more frequently than every 2 years and establishes additional enforcement authority for the commissioner. And amendment number 6 clarifies the carrier's burden of persuasion and provides that failure to submit complete Parity Act compliance information is a violation of the Parity Act. The amendment also repeals the requirement that the commissioner require use of a specified form.
That was a lot of work. Thank you very much. Delegate Collison.
Thank you, Lisa. Thank you, Delegate Bagnell, for, I can honestly say that every detail of this bill was worked, had to be worked through in order to get us to the place where we are now. Just to make clear what the purpose of this bill is to make sure that insurance carriers are treating and creating access to mental health and substance use treatment equal to the treatment that they do for other medical issues. That's the purpose of the bill. And what this bill now does is makes it possible for the Maryland Insurance Administration to use the information they get in a meaningful way. So with that, I would like to move the amendments.
The amendments have been moved and second. Are there any questions regarding the amendments? Yes, Delegate Lewis.
Thank you, Madam Chair.
You're
Thank you, Madam
welcome.
Vice Chair. Just to make sure I'm understanding the terminology. In the bill, it refers to non-quantitative treatment. That means social, psychological, anything non-pharmacological, I'm assuming.
It actually applies to the parameters that carriers use in order to deliver service. So an example of an NQTL would be, what are the parameters they use to prior auth behaviors? What are the parameters they use to measure their networks? Those are examples, and there are like 100 or more of those NQTLs.
And those are super important for parity. Thank you so
Right.
much.
Any other questions or concerns? Okay, all those in favor say aye. Oh, okay, Delegate Taveras.
Thank you. So I'm just questioning whether, does this put a limit on the number of sessions a mental health provider can grant?
Absolutely not.
So because I always understood parity as something that somebody with a debilitation should always be able to have consistent service on that debilitation, whether, that's available, however codified through the DSM-5 or whatever it is that they use to categorize. There used to be the time when they did stop and gave you 20 sessions.
Right.
So that's, and you're saying that the NQLs used to be, that's what they used to use to set the limit?
Exactly. That would be an example of an NQTL that they were using in order to, provide the treatment. They could still potentially use that, but when they turn that into the MIA, they would be in trouble under this bill, because that is not treating mental health services in the same way that they would be treating medical services.
Thank you.
Any other questions or concerns? Seeing none, okay, on the amendments, again, all those in favor, it's been moved in second, say aye.
Aye.
Any opposition? Seeing none on the bill as amended? It's been moved in second, all those in favor say aye.
Aye.
Any opposition? Seeing none, the bill passes, and this is, who does not want to be on this bill? And can I just say thank you very much, Delegate Collison, for your hard work on this, and Lisa, you ladies really work really hard. And I want to say to the advocates out there, I hope that you accept this bill, because if you try to change it across the street, it will probably fall apart. It was a lot of negotiation. It really was. So I'm asking you, if you wanted to, please, let it go, because it will be tough. It's tough. It's like a puzzle. You don't find the piece and it breaks. You can never put it back together. And it was a lot of work for these ladies to put this together. So let's go on to House Bill 1078, Delegate Woods. It's Maryland Medical Assistance Program, remote ultrasound procedures and remote fetal non-stress test. It was favorable. It's Aaron and Bagnall. Aaron.
The bill requires Medicaid to provide remote ultrasound procedures and remote fetal non-stress tests using current procedural terminology codes if the patient is in a residence or a location other than the office of the patient's provider, and the provider follows the same standard of care that the provider would follow when providing services on site. Medicaid must provide reimbursement for a remote fetal non-stress test in the same manner as an on-site fetal non-stress test. There were no amendments.
Delegate Bagnall.
Everybody loved this bill and it was unanimous, and I would move the bill.
The bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none? All right, so we cannot amend because it's favorable. Let's go on to, but we're there in spirit. Go ahead, Delegate Shaliga.
Very proud to vote for House Bill 981, but I do not want to be a co-sponsor if that's
Okay. No? Okay. All right, thank you. Delegate Woods, 1105, Advanced Practice Registered Nurses, favorable, Lindsay and Rosenberg.
This bill requires an individual to be certified as an advanced practice registered nurse before practicing advanced practice registered nursing in the state, except as specified. Requirement does not apply to a student enrolled in a graduate level accredited program for advanced practice registered nursing while practicing advanced practice registered nursing in that program, or an individual permitted to practice advanced practice registered nursing under rules and regulations adopted by the Board of Nursing. There are no amendments. It was considered in Health Occupation Subcommittee.
Okay.
Madam Chair,
Yes,
unamended and unopposed, move the bill.
the bill has been moved in second. Any questions or concerns? Yes, Delegate Shaliga.
I would just like Lindsay to say advanced practice nurse another 20 times fast.
Thank you. All right. And we voted it, right? House Bill 1110, Maryland Interstate Emergency Management Assistance Compact, City of Frederick. It is favorable, and it was Lindsay and Kurt. Lindsay.
This bill includes the city of Frederick as a participating jurisdiction in the Maryland Intrastate Emergency Management Assistance Compact. No amendments. It was considered in Government Operations Subcommittee.
Delegate Kurt. Thank you, Lindsay.
It was a unanimous in subcommittee. I moved the bill.
All right, it's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes unanimous. House Bill 1125, certified nursing assistants licensing requirements and administrative updates. Favorable with amendment, Lindsay and Rosenberg. Lindsay.
As originally introduced, this bill alters the designation of and licensure requirements for a certified nursing assistant, creating new designations of certified nursing assistant 1 and certified nursing assistant 2. On or after, again, as originally introduced, on or after June 1st, 2024, a geriatric nursing assistant and any CNA that has passed a specified nursing assistant training program and competency and evaluation will be designated as a CNA 1. Those that do not meet these requirements will be designated as a CNA 2. By October 1st, 2024, as originally introduced, the State Board of Nursing must notify individuals with a nursing assistant certification of the bill's requirements and update regulations to conform with the bill in consultation with the Office of Healthcare Quality. The bill also alters exemptions from specified certification requirements, authorizes an acute care nursing assistant training program to request a specified waiver and make clarifying and conforming changes. The amendments that begin on page 78 of packet 2 and continue on to packet 3 delay applicable dates in the bill, provide a licensure exception for a student to perform nursing assistant tasks while practicing under the direct supervision of qualified faculty and enrolled in an acute care nursing assistant training program, and retains the exception for a student enrolled in a board-approved nursing assistant training program, retains the requirement that an RN or LPN may delegate nursing or other technical tasks to an unlicensed individual only if acceptance of those delegated tasks does not become a routine part of the unlicensed individual's job duties, requires the board to adopt regulations after consultation with stakeholders rather than in collaboration with stakeholders, makes changes reflecting that certificates are available through the board's website rather than issued to the practitioner, retains a provision of law specifying that the provisions may not be interpreted to impose additional requirements beyond those required under federal law, retains a provision requiring the board to approve the use of a nursing assistant training site within 45 days if the program has previously been approved to use the site, and specifies that the program may continue to operate during the approval process, and strikes language authorizing an acute care nursing assistant training program to request a waiver of the federal requirement that instructors have a minimum of 1 year of experience in the provision of long-term care facility services.
Oh, wow. Okay. This was Rosenberg. It's a lot of reading, ladies. Go ahead, Rosenberg.
But it was unanimous.
All right. Okay, do you have a
Move the
motion?
bill.
No, you have the amendments.
Oh, sorry, move the amendments.
All right. The amendments have been moved in second. Any questions or concerns? All those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended. It's been moved in second. All those in favor, any questions or concerns? All those in favor say aye. Aye. Any opposition? Seeing none, who does not want to be on this bill? Okay. House Bill 1143, Emergency Medical Services, Maryland Emergency Department Wait Time Reduction Commission and Standardized Protocols Establishment. It was favorable with amendment. It is Aaron and Kerr. Aaron.
This bill, there is a reprint of this bill on page 92 of your packet that reflects amendments that were adopted in Government Operations and Health Facilities Subcommittee. The bill establishes the Maryland Emergency Department Wait Time Reduction Commission to address factors throughout the healthcare system that contribute to increased emergency department wait times. The commission consists of the Secretary of Health, Executive Director of MIMS, HSCRC, MHCC, 2 individuals who have operations leadership responsibilities over a hospital or emergency department in the state, including 1 emergency department physician, 1 individual with professional experience in an emergency department who is not a physician or an advanced practice provider, 1 representative of a local emergency medical service, 1 representative of a managed care plan with experience in care management, 1 representative of an advanced primary care practice, 1 representative of a patient advocacy organization, a representative of a behavioral health provider, and a member of the Maryland Hospital Association. The commission is authorized to establish work groups that include members who are not on the commission. The HSCRC will staff the commission, and the commission's responsibilities include the development of strategies and initiatives to reduce emergency department wait times, including initiatives that ensure patients are seen in the most appropriate setting, improve hospital efficiency, improve post-discharge resources, and facilitate timely emergency department and inpatient discharges. There's additional the commission is authorized to request data from MDH, MIMS, HSCRC, the Healthcare Commission, the State Designated Health Information Exchange, hospitals in the state, and other providers of healthcare services and payers of healthcare services. So there is language in the bill providing for the transfer of data to the commission and the privacy of that data. Then on or before November 1st of each year, beginning in 2025, the commission is required to submit reports to the Governor and General Assembly on a report of its activities and findings and recommendations, including an update on the development and impact of policies and programs developed to improve emergency department wait times, and the bill sunsets June 30th, 2027.
All right, Aaron, you can breathe now. Delegate Kerr.
This one tried to get away from us, but with a lot of work from Aaron, we reined it back in. There was some concern in the subcommittee about the omission of having representatives from labor on the commission. Nevertheless, it was a unanimous vote in subcommittee, and I move the amendments.
The amendments have been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any objection? Seeing none on the bill as amended? It's been moved in second. Any questions or concerns? And if I may just add, in order to deal with that later on, because there'll be many other people that will want to come and be on it, the bill allows for subcommittees to be created like we did last year with the public health and behavioral health bills. So as we need people, they can come in to the fold. But it does include the hospital, and it does include the ER doctors, right? And behavioral health as well. Yes, all those in favor of the bill as amended, say aye.
Aye.
Any objection or concerns? Delegate Lewis.
Thank you, Madam Chair. I just want to make sure I understand, Madam Chair and Chair Kerr. You mentioned that there was concern about labor not being included, but the chair is saying that if they wish, if it makes sense, they could participate in subcommittees later.
Because the bill requires, it states that subcommittee can be formed for that purpose.
Committees would be formed by the members of the commission. Is that so? How would they be established?
What is the language? 1 second, Delegate.
Thank
Good
you.
question.
Oh, okay. The commission may create advisory work groups that do not include members of the commission. So it would be up to them who was on.
You're welcome. You're welcome. Any other questions or concerns? Okay, all those in favor say aye of the bill as amended. Any objection? All right, who does not want to be on the bill? And I just want to take a minute to say thank you to the committee members who were part of the commission of the work group. Thank you all. I think there were 3 from here. And Delegate Randari, thank you for your leadership. I do also want to take a minute to thank the Senate and the chairman of the Finance Committee, Chairman Bidel, because she actually, I became aware that she actually attended every meeting and contributed greatly to the discussion and to the process. So I know the bill was not crossed because the sponsor ran out of time. It was not intentional. Usually we have bills crossed, right? But I do want to give equal credit to the Senate as well, because the chairman of finance did a lot of work. So I want to say thank you so much. I really appreciate working with her and with the Finance Committee. May we move now to House Bill 1155, Delegate Stewart and Buckle, Hospitals Opioid Overdose Medication Assisted Treatment, favorable with amendment, Aaron and Kurt. Aaron.
There's a reprint of this bill on page 99 that reflects amendments adopted in Government Operations and Health Facilities Subcommittee. The bill requires each hospital to establish and maintain as part of its emergency services protocols and capacity to provide to a patient before discharging the patient appropriate evidence-based interventions that reduce the risk of subsequent harm and fatality following an opioid-related overdose or a visit for an opioid-related emergency medical condition. Each hospital must possess at least one formulation of each U.S. Food and Drug Administration approved full opioid agonist and partial opioid agonist used for the treatment of opioid use disorder, and treat a patient who presents in a hospital emergency department for care and treatment of an opioid-related overdose or opioid-related emergency medical condition with a medication for opioid use disorder. The bill also provides for, clarifies how a patient would be connected to treatment post-discharge. And in addition, the bill has introduced, required the protocols to be funded through opioid restitution funds. That language is stricken. And then instead there's an assessment, there's uncodified language about a study that would assess whether and how the bill could be funded through ORF funds. And the bill's implementation date is delayed to January 1st, 2025.
Okay. Delegate Kerr.
Thank you, Madam Chair. The amendments address the concerns of the opposition. It was unanimous in subcommittee. I move the amendments.
Second.
The amendments have been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? All right, the bill passes. Who does not want to be on this bill? It's only Stewart and Buckhill. You know, I love I love that bipartisanship. All right, House Bill 1168. It's human remains. That was favorable with amendment, Lindsay and Rosenberg.
Generally, this bill requires the Office of Cemetery Oversight in conjunction with the State Board of Morticians and Funeral Directors to adopt regulations establishing a process for regulating crematories that use alkaline hydrolysis, reduction facilities that use natural organic reduction, and registered reduction operators. There's a reprint of the bill beginning on page 106 in your packet with amendments adopted in Health Occupation Subcommittee that remove references which would have made licensed funeral establishments responsible for handling soil remains from natural organic reduction, makes technical changes, clarifies that disposition of soil remains on private property requires written permission of the surviving owners of public record of that property, ties the definition of authorizing agent to another provision of law, which it was already mirroring. It's just adding a cross-reference instead, adds a definition of soil remains to the Mortician and Funeral Directors Act, requires regulations adopted by the Board of Morticians that are identical to those adopted by the Office of Cemetery Oversight to meet requirements established under the Cemetery Act regarding natural organic reduction, and adds a provision regarding notice to the Department of Veterans Affairs and transfer of unclaimed soil remains of a veteran or eligible dependent.
Delegate Rosenberg.
Yes, you may recall there was similar legislation introduced last year. However, we knew at the hearing when Mr. Doyle testified in support that the sponsor, Delegate Kaiser, had done her work in the interim. Committee did further work, and the bill before you was opposed by one member of the committee, of the subcommittee. And this is a recognition that this is an aspect of funeral care that is growing and therefore should be appropriately regulated by the state. So I would move the amendments.
The amendments have been moved and second. Any questions? Delegate Shalika.
Where did the funeral directors come down on this?
Yes, Delegate Kaiser.
They came in to speak. They had originally signed up in opposition, but when they saw the final amendments, they said they were good. They spoke their kumbaya at the dais.
Yeah.
One more question about,
Do you remember the picture that I took? I have a beautiful picture of him smiling. I swear it's such a gorgeous picture. I have to give it to him because it's the first time he testified like supporting something.
there was discussion last year about the mulching. Is that in this bill?
Have to find that in the,
Let's see.
yeah, give me a second. Someone else, I don't know if the analyst has it.
Hold on a minute.
But we dealt with what we call concerns, but let me
We're
find
gonna
that for
find
you.
Lindsay will find it.
Okay.
Hold on one second.
Objections about soil prohibitions. There's language in here, may have been amended slightly just for wording, but a person shall not use or dispose of soil remains produced by natural organic production on public or private property without express
written permission, and then there's an A, B, and C to that, that it can't. I will find it for you in a moment.
It's page 125.
And you can't grow livestock, you
And
can't,
then it goes
no
into-
sale either.
The bottom of 125 onto 126.
Burying someone in the backyard? No?
Yeah, but I mean, burying someone on a family cemetery plot is different. This is the use of the soil remains.
So body
One
is
second.
reduced to soil or mulch or something else, and then they can be placed on your property?
Sorry, you're asking about if you have remains of a loved one and you want to use it on your own property?
Yes, just
So
specifically.
it requires the prior written permission of the owner of of public property or the surviving owners of public record of private property. So you would give the permission to yourself, I suppose. If it's your property, you can grant your own permission.
What can you tell me about page 126, lines 7 and 8, by using the soil remains to grow food?
There's a prohibition. You cannot,
Oh,
you
good.
cannot use it for that.
Phew.
Sorry, start on
second,
page,
guys. One
start on the
minute.
bottom of page 125.
Okay,
Lines 29 and 30. A person may not use or dispose
Oh.
of soil remains produced by natural organic reduction
okay.
So
to
then you're
grow
going to,
food.
by
Okay.
using soil remains to grow food for consumption by humans or livestock.
Great, thank you. Okay, thank you.
No, good questions. Thank you. This is the place, and I told you that I really welcome it. I want us to vet this here so that we have no problems on the floor, and I welcome each and every one of you, excuse me, each and every one of you, your thoughts, okay? Like, we want to work it out here, all right? Any other questions about this bill or concerns? Yes. Yes. Delegate Kaiser.
Since last year, and thank you Delegate Rosenberg, but it was my advocates more than me, but it was addressing a few things by adding an alkaline hydrolysis, by addressing all of the concerns of the Office of Cemetery Oversight, the Board of Funeral and morticians, and I'm sorry, I'm getting the acronym all wrong. Dealing with all of their different concerns and then dealing with the things that got brought up last year, like the Home Depot, like the backyard, all the pieces. So really a lot of time and effort was spent to try to address all those things, knowing of course that some people still might not be comfortable with giving this option to Marylanders and allowing our small businesses to do this, but really trying very hard to address all the concerns that people brought up last year.
Delegate Chisholm.
Thank you, Madam Chair.
You're
One-
welcome. Delegate
One last
Chisholm.
thing, was any consideration given to Delegate Rosenberg's request to be buried at Camden Yards?
Moving on. There you go. That's the caveat. I like that. All right, any other, Delegate Riley,
Thank you.
you're welcome.
I do have one more question.
Yes.
So say that it was my property, I gave myself permission and I put it on my flowers or my lawn somewhere. And then next year I sell my house. Do I have to disclose that in a real estate deal? Is that in the bill?
Give us a minute, 1
Uh-huh,
second. It's
sure.
a good question.
Mhm.
You know what? I wonder if are there any real estate agents here? Because you know how they have, does it, because it makes you disclose certain things. Do you know if it's,
On the property.
It's human remains.
Yeah.
Human remains, it
Yeah.
does? Cause I thought it does. I thought the contract has something like that.
Yeah, no, there's the provision in there.
Okay.
It's just same as a buried oil
Yeah.
tank.
The bill is silent, but the contracts usually address that. But they're human remains. No? Okay, go ahead, Delegate Hutchinson.
Well, the question would be, what if it was a cremation and there was ashes and you sprinkled the ashes in your garden?
But it's illegal to spread your ashes currently.
Yeah, I know, there's,
I mean, I've never seen that ever proposed. I mean, I've seen contracts where you had to,
you're right about
with
that.
burial
There's only
sites.
certain
I
places
mean,
you can-
actually I have a cool story of one where a lot caught on fire and we end up finding like 7 headstones there from like the 1840s
Mm,
on there.
Wow.
So it does happen quite a bit, especially in Maryland, because we've been around for a while. But as far as like spreading ashes, that's a good point. I've never seen that come up.
Hmm.
I mean, we could call the real estate commission. I mean, they would be able to tell you.
All right, so I have a proposal in a minute, Delegate Hill, and then Delegate Johnson. What is it?
Yeah, that's what I was gonna
Isn't it
say.
grave sites that have to be disclosed? Yeah.
All right,
I
Delegate,
think
Delegate Hill.
I think part of the issue with dead bodies, other than mass murderers, is the concern that moving those bodies because of the sacredness of them requires, a real process, and you're not supposed to disturb them. And so if a realtor or a homeowner doesn't disclose, then they're really not telling the buyer that there's something going on with the property that may affect the resale value or may actually cost them later if those remains need to be, whereas ashes and this alkalinized remains wouldn't have that same thing. There's no call for, bringing them up and planting them and relocating them. So I don't think it's the same thing, but
So
I think
I
it's a
just
question worth having.
Look at Google, the attorney. And it says Maryland, like many states, doesn't have any laws restricting where you can scatter ashes. Yeah, so I think that's your answer, okay? I think that's your answer, okay? I love the discussion and truly. All right, any other concerns or questions? All right, seeing none, where was I? Move the amendments. The amendments have been moved in second. All those in favor say aye. Aye. Any opposition? Seeing none, the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none is unanimous. Who does not want to be on the bill? All right. Oh, Delegate, 1 second. Who does not want to be on the bill? If you could raise your hand, I'm gonna go slowly. Shalega, Chisholm, Morgan, Olston, Bandari. Oh, I'm sorry. Shalega, Chisholm, Morgan, Olston, Bandari, Kipke, and Riley. That's a Dominican talking. I'm gonna slow myself down. Sorry. Okay, I know my husband's gonna be so happy with his bill. All right, let's go on to House Bill 1171. And I did ask who does not want to be on it. All right, 1171. It is Delegate Williams, non-prescription drugs devices, provision by registered nurses and sale of contraceptive through automatic devices. It was voted favorable with amendment out of subcommittee. It is Aaron and Bagnell. Aaron.
There's an amendment in your packet on page 133 that was adopted in the Public Health and Minority Health Disparity Subcommittee. As amended, House Bill 1171 repeals a prohibition against and related penalties for selling and offering for sale a non-latex condom by means of a vending machine or other automatic device. In addition, the Committee on Registered Nurses personally preparing and dispensing drugs, which already exists under current law, must include additional information on non-prescription contraceptive drugs and devices approved for over-the-counter use within its formulary. The bill also authorizes a registered nurse to provide non-prescription drugs and devices without a prescription in local health departments.
Okay, this is Rosenberg. Oh, no, I'm sorry. It is Bagnell.
Thank you, Madam Chair. So we took this bill in a couple of chunks because we had a criminal provision and the health provision to make sure that everyone was clear on what the bill now does. We had a really robust discussion on vegan condoms, and I will tell you that my search history makes me look way cooler than I am. And the rationale behind still prohibiting natural membranes because they tend to break down faster, and also they are not a good they are not a good prohibition barrier against STIs. And then we had the discussion on the health general, which is protecting our nurses in local health departments who are providing over-the-counter medications and devices, and also with that we actually it was unanimous, and I would move the amendments.
All right. Any questions? All those in favor or concerns? All right. Oh, Delegate Shalega. Oh, Delegate Chisholm.
Yeah, I couldn't remember, but I wanted to ask Aaron again. Natural membrane, were the vegan ones or the non-vegan ones? Which ones were vegan and which ones are non-vegan? I wanted.
So the natural membrane are the non-vegan. They're essentially lambskin, which are not used very often. They are and we don't want them in vending machines because they're not a good barrier against STIs, and they tend to break down faster. The vegan options, which are non-latex but available for people with latex allergies, are polyurethane, polyisoprene. So synthetic substances.
Perfect. Thank you.
Delegate Shalega.
So all this bill is saying is that they cannot put certain condoms in a vending machine?
Yes.
It's repealing a criminal penalty.
So the
Because
current law says if you put if you put a certain condom in the vending machine, you can actually get a criminal penalty?
Right, and we're repealing that because at the time of this statute, latex condoms were natural membrane condoms were the only non-latex available, which is why this prohibition was there. Since then, we've developed vegan condoms, and
Wow.
and so now we are repealing that criminal prohibition and expanding reproductive access for men who want choices.
Thank you.
Great questions. Any other questions? Oh, Delegate Hill, followed by Delegate Hutchinson.
If we could amend the bill, I know it's in subcommittee, to require that the General Assembly have a reproductive health class every 4 years.
Wait a minute, is that a mandate? What's that fiscal note? Delegate Hutchinson.
Chair, I just like to go on record that my searches on my state issued laptop today under the title of contraceptive devices and female condoms was for research purposes on Bill 1171. Thank you.
I think that we would apply that to all 23 members and committee staff. Committee staff, okay? So. All right, who does not want to be on this bill? Okay, I'm gonna go slowly. Delegate Shalega, Delegate Morgan, Delegate Chisholm, Delegate No, we haven't voted on it? Oh.
You're just excited.
Oh, I was excited. Hold on. Okay, so on the amendments, they've been moved in second, right? Oh, move it again, just in case. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye of the amendments. Any opposition? On the bill as amended? It's been moved in second. Any questions or discussion? All those in favor say aye. Any opposition? Seeing none. It's unanimous. Who does not want to be on the bill? That is, okay, so that is Chisholm and Morgan, Riley and Kipke. Okay. All right, so who doesn't want to be on it is Morgan, Chisholm, Riley and Kipke, okay? Yeah, so four of them. Chisholm and Riley. Okay, let's move on. House Bill 1259, health insurance, breast and lung cancer screening coverage requirement. Huh?
I'm sorry.
1250. All right, 1259, guys, come on, we're almost done. House Bill 1259, health insurance, breast and lung cancer screening coverage requirement. It was favorable with amendment. It is Lisa and Collison. Lisa, we're almost done, guys.
This bill expands the current prohibition on cost sharing for coverage of supplemental breast exams to include image-guided breast biopsy. The current mandated health insurance benefit for coverage of recommended follow-up diagnostic imaging to assist in the diagnosis of lung cancer is clarified to include lung cancer screening and provides that the coverage may not require prior authorization. Additionally, a carrier may not impose cost-sharing requirements for lung cancer screening. There are amendments on page 135 of your packet that clarify the prohibition on prior authorization and remove the exception for high deductible health plans for lung cancer screening because it's already recognized as preventative care for purposes of the IRS rules.
Okay, Collison.
Thank you, Madam Chair. There was a brief discussion about the role of prior authorization in the subcommittee, but ultimately the bill was, the amendments were passed and unanimously and the bill unanimously. So I would move the amendments.
Second.
Is removed in second. Any questions or concerns? See none of those, oh, yes, Delegate Hill.
Just real quick,
Yeah.
Madam
Yes.
Vice Chair. The change of the total appropriation from 2 million to 750, did that require?
That's the next bill.
Okay,
It's okay, you're on
We'll
top
take
of it.
okay.
It's all right. So any other questions or concerns? The amendments have been moved in second. All right. All those in favor of the amendment say aye.
Aye.
Any opposition? See none. Now Delegate Bandarian, the bill as amended. Is it moved in second? Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none, who does not want to be on this bill? Can you raise your hand? Okay, let's go on to House Bill 1293, Delegate Woods, Maryland Department of Health Public Education Campaign on Prostate, Lung and Breast Cancer Prevention. It was favorable with amendment. It is Aaron and Bagnell. Aaron.
There is a reprint of this bill on page 136 of your packet that reflects amendments adopted in Public Health and Minority Health Disparities Subcommittee. The bill requires the Maryland Department of Health to develop and implement a 3-year public education campaign on prostate, lung, and breast cancer prevention that targets communities disproportionately impacted by those cancers. The campaign must provide educational information, promote screenings, and provide information on legislation that reduces cost barriers to prevention services. The Department of Health must set measurable goals for the public education campaign and report to the General Assembly by January 1st, 2027, and annually through January 1st, 2029. For fiscal years 2026 through 2030, the governor must include in the annual budget bill an appropriation to MDH from the Cigarette Restitution Fund for the public education campaign. The total amount appropriated from the Cigarette Restitution Fund for the public education campaign over that period, as well as any funding that may be appropriated in fiscal 25, is capped at $750,000.
Delegate Bagnell.
Thank you, Madam Chair. This was popular and non-controversial and passed unanimously, and I would move the amendments.
Second.
Amendments have been moved in second. Any questions or concerns? Delegate Hill. You're welcome.
I just wanted clarity about the going from 2 million to 750. Was that an arbitrary number? We went to another arbitrary number. Was anything, or was taking out the education piece about promoting participation, did that take that down? Or did we just pick a number?
Delegate Bagno?
Is anything missing?
From our understanding of the recommendation, it was because they recognized that they could use some of the existing program and campaigns, and that they were using additional funds to focus on prostate cancer, which where we have the least amount of campaign materials.
Okay.
Thank you. Yeah. We.
No, I'm glad you asked it.
Yeah.
I'm glad you, someone
And
may
because I
ask.
didn't know if we were missing something, if we took something out. We can't afford the 2 million, but it'd be nice to know how we can afford, how we can afford to do it for less and why we asked for that money in the first place.
No, it's a good question and it will probably come up. So it's good. We're ready to answer it.
And that we do have some existing materials and programs already that we can utilize.
All right. Any other questions? All right. On the amendments, all those in favor say aye. Any opposition? Seeing none, on the bill as amended. Is it moved in second? Any concerns or questions? Seeing none, all those in favor say aye. Any opposition? Seeing none, is unanimous. Who does not want to be on this bill? Okay, let's do House Bill 1333, Maryland Commission on Health Equity Membership and statewide health equity plan, and this was favorable with amendment out of subcommittee. Aaron and Bagno. Aaron.
There is an amendment on page 141 of your packet. And this bill requires the Maryland Commission on Health Equity using a health equity framework to develop and monitor a statewide health equity plan as required by the Center for Medicare and Medicaid Innovation under any agreement entered into between the state and the Centers for Medicare and Medicaid Services. The commission must coordinate with the Maryland Department of Health and the HSCRC when establishing an advisory committee. The amendments add the executive director of the Maryland Community Health Resources Commission to this commission, and also provide that the Maryland Commission on Health Equity extends their final report date. It also extends the final report date of the Commission on Public Health to October 1st, 2025.
Delegate Bagno.
Thank you, Madam Chair. This was non-controversial. Once we clarified that the amendment was to give the Public Health Commission a little more time, and it passed unanimously, I would move the amendments.
Second. All right. Any questions or concerns about the amendments? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none, on the bill as amended. Is it moved in second? All those in favor say aye. Any opposition? Seeing none, is unanimous. Who does not want to be on this bill? All right. House Bill 1339, Delegate Riley, health insurance, hearing aids for adults coverage. It was favorable with amendment. It is Lisa and Collison. Lisa.
This bill requires carriers to provide coverage for all medically appropriate and necessary hearing aids for an adult covered under a policy or contract. Carriers may limit the benefit to $1,400 per hearing aid for each hearing impaired ear every 36 months. An insured or enrollee may choose a hearing aid that is priced higher than the benefit limit and pay the difference. The bill does not prohibit carriers from providing coverage that is greater or more favorable. There's an amendment on page 143 of your packet that specifies that for hearing aids to be covered under the provisions of the bill, they must be prescribed, fitted, and dispensed by a licensed audiologist.
Delegate. Oh, that's a cute Delegate Collison.
But now we know you'll be able to afford a hearing aid, Delegate Hill. I first want to thank Delegate Riley for her work on this.
Yes.
She did a
She did.
tremendous job working with the carriers to make sure that to achieve this benefit. And with that, I would move the amendments.
The amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor of the amendment say aye. Any opposition? Seeing none, on the bill is amended. So moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes unanimous. Who does not want to be on this great bill that Delegate Riley worked so hard? All right. Great job, Delegate Riley. And we're going back. We have one bill left. Well, we have one. All right, we have House Bill 76. It is Delegate Lopez. It's titled Health Occupations Pharmacist Administration of Vaccines. It is an emergency bill. It was voted out of subcommittee favorable with amendment, and Lisa is the analyst and Collison the chair of the subcommittee. Lisa.
As introduced, this emergency bill repeals obsolete language that temporarily authorized a licensed pharmacist to administer certain vaccinations under specified circumstances to individuals ages 3 to 17. There are amendments on page 1 of your packets. We're going backwards here. Page 1, and they authorize pharmacists that meet specified requirements to order and administer influenza vaccines, COVID-19 vaccines, or vaccines used in response to a public health emergency for children who are at least 3 years old, and vaccines that are recommended by the Centers for Disease Control or approved by the Food and Drug Administration to children who are at least 7 years old.
Okay, Delegate Collison.
With the amendments, the bill passed out of subcommittee. I believe it was not unanimous. It was not
It
unanimous.
was party
Right,
line.
right. So I would move those set of amendments.
Second.
The amendments have been moved and second. Any discussion on this set of amendments? Seeing none, all those in favor of the amendment say aye.
Aye.
Any objection? Seeing none on, okay? On,
On the bill as amended, please? Oh, I'm sorry. Wait a minute. No, we have, I think we have another set of amendments.
Delegate Kipke.
I tried to. get away
I
with
see
it.
you, I see. He's moving it and moving it and moving it.
Thank you,
Delegate
Madam.
Kipke.
Thank you, Madam Chairman. I have 3 amendments. The first amendment would require that a pharmacist receive a signature that the person is attesting that they are the legal caregiver for the child. You may recall that some of the opposition to the bill was related to the term caregiver. And I don't think that's an unreasonable thing to do when, when you pick up a prescription for yourself or a family member, you have to sign. If you need, do you want any more information about the treatment that you're purchasing? So it's something that could be handled within their existing system. The amendment also carries with it the same language for perjury. So it would be you could be if you lie, if you willfully provide a false attestation. You could be guilty of a misdemeanor and on conviction shall be subject to a fine not to exceed $1,000 or imprisonment not to exceed 3 years or both. So that would be left up to the court. I don't think that this is a major issue that would present itself. It would probably be infinitesimal, but for the occasion that it were to take place, as a parent, I would be outraged beyond all belief. And so I think it's a reasonable accommodation to the opposition to the bill and would, so I offer the amendment. Thank you.
Yes, Delegate Collison.
First, I want to thank the delegate for providing me with his amendments in advance. And I would ask the committee to reject this amendment because not that it's not a good idea, but it's already in law. In fact, it's in Health General, section 18-48-01, which defines parent. And this is under the section of law who says who can approve an immunization for their child. And then section 14-4A02 defines how a parent might delegate that authority to another. And these are the laws. We are not changing the law that currently exists around parental consent for immunization. So I don't think we need that in this bill, and I would recommend resisting the amendment.
Okay.
Oh, so I have to move unfavorable position on this amendment.
He didn't, He moved the
No
amendment.
one, no one
but no
seconded
one
his amendment.
seconded.
So do I.
Hold on one second, okay? We dealt with the first set of amendments. They came out of the subcommittee, right? We all agree on that. Delegate Kipke has an amendment that he has just moved, and he moved it, right? There was no second at the time, but Delegate Collison responded to it, why she didn't think it was feasible. Okay, so I'm gonna take the questions now that you guys have. I'm gonna ask you first, Delegate Olston. Oh, Delegate Kaiser was first, then let's go with Kaiser.
Thank you, Madam Chair. I certainly share Delegate Kipke's concern. I wouldn't want anyone doing this for my child without my permission. I wouldn't want anyone giving my child a haircut without my permission. But as I understand it, the bill is silent on this because it's already current law. So I just wanted to echo the subcommittee vice chair's point that we don't need the amendment. Thank you.
Okay, Delegate Olston.
Thanks. I actually share the same concerns. My question was, and I was listening, but I didn't have anything in front of me. Were you saying that there was going to be a criminal penalty? I wasn't clear on that. And is that criminal penalty in current law, or is that part of your amendment?
1 second, let's get the answer now, Delegate Kipke.
The answer is it would be added to this section of the code, but it's copied from the perjury section of the code. So it's the same language as what is the crime for perjury.
But if I may, for clarification, Delegate Kipke, you're adding a new provision, a penalty for that, correct?
That would add a penalty for willfully lying
Under this statute.
under this vaccination with minors statute.
Yes.
And then, so you're saying it's in current code, is it in current code for like illegally vaccinating someone or current code for committing perjury?
Committing perjury.
So the illegal vaccination is not against the law.
This amendment just speaks to, so in current law, there is a provision of who can be a parent and their designee. There's a legal framework that exists for that. So I guess an individual parent could, if they find out, could potentially sue somebody who did this to their child. However, my thought is that there should be at the counter before it happens, because you can't undo it. Someone would have to be checked. Do you have the legal authority to do this? Sign here. And for willfully misleading or lying about that, there would be a penalty, which is consistent with perjury.
Okay, thank you.
Okay, Delegate Morgan, and then Delegate Johnson,
Thank
then
you.
Hutchinson, one at a time, please. Delegate Morgan,
Thank you, Madam Chair.
you're welcome.
My question is about the practicality of this. If a caregiver, however we're defining a caregiver, takes a child to the pharmacist, is there any penalty now for them signing off on this vaccine? I
1
mean, how's it
second,
defined
please.
caregiver?
1 second, Delegate Lopez, who is the sponsor of the bill, would like to be heard while Lisa finds the code. Go ahead, Delegate Lopez.
There we go. I'd remind the committee that one of the questions that came up was about, or I should say it was in written testimony, that this has been the practice for 4 years now, and there's been no incidents of this happening. There has been emails that have been circulating saying that, it's possible for a babysitter to take your kid to be immunized, or maybe the daycares will load up their kids on the school bus and take them to be immunized. This has been law nationally for 4 years, and there's no incidents of this happen. And so I can only speculate, but there's probably no penalty that's currently in our code because there's been no incident to prompt that.
And and there's no definition of caregiver that we know of, correct?
Correct.
Okay. Delegate, my pleasure. Delegate Johnson, followed by Hutchinson.
Thank you, Madam Chair. Actually, my question was asked by Delegate Morgan. However, I do know in a pharmacy, when you do have family member or friend pick up a prescription, it has to be a pre-authorized person. So they have to already let the pharmacy know that that person could come in and pick up your prescription, be on the list. But Delegate Morgan asked my question about, is there currently a penalty in law if you do something like this?
Okay, thank you. And we'll look for it, okay? And while we look for it, Delegate Hutchinson.
Just a quick question for the vice chair. You mentioned two statutes. You routed them off quickly. Could you repeat them again?
It's Health General, 18-4A is an apple -01. And then the subsequent chapter, which is 18-4A02. So 4A01 defines parent and 4A02 defines how a parent can give authority to have their child taken to the pharmacy.
Okay. Delegate Hill.
Thank you, Madam Chair. Delegate Kipke, I'm trying to imagine how this might actually work in the real world. So I've got now grown, my sister has children who are now grown, but when they were younger and they were in my care, there were things that she and her husband would allow me to do. And you take them to get their earrings pierced, blah, blah, blah. No papers were signed. You know, just when they're with you, can you take care of it? So what I'm not clear about, it sounds like the way your amendment would work is if I took them and didn't have it in writing, that I would be lying because I'm not officially their caregiver, although my sister gave me permission. And if her husband later took issue, even though she'd given me a permission, that I'm now in hot soup, although I didn't deliberately lie. So it seems like your amendment would really be talking about not even the act, but whether there was a lot of, you know, whether things were handled officially or not, and get into the technicalities. So what am I not understanding?
So I believe under the existing statute, who has authority to do that is already spelled out. So in a situation like that, if one of the parents gives permission, you have the legal permission. Not according to our current law.
Okay. And I looked up, can you in Maryland pick up someone else's prescription? You were asking, and it says that you can, as long as the person is given permission. And if it's a controlled substance, then you need to have identification. And I know I done that for my mom-in-law. You know, you have to have your license to be able to pick it up as well. Yeah, you have to sign, and you have to sign for it as well. Delegate Shalega.
I would note that picking up a prescription and dropping in at a flu shot clinic are different. So yes, picking up prescription is physically different than a drugstore having a flu shot clinic or whatever, an influenza vaccine or a COVID-19 clinic where
It is, but his question was just about the picking up. But you're right, they're two separate concepts. Okay. Thank you, Delegate Shalega. Thank you, Delegate Johnson. Any other questions about Delegate Kipke's amendment that was moved by him and second by Morgan, correct? Seeing no other questions, all those in favor of Delegate Kipke's amendment say aye, or raise your hand, will you? Okay, Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Olston, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. So party line plus Olston, okay? It makes it easier. It makes it easier, okay? So all those in favor, please raise your hand. Well, the rest of you, raise your hand. Actually, I'm sorry, all those opposed, I'm so used to saying in favor, opposed, raise your hand, please. So that's The rest of it, Gazzoni, Lewis, Woods, Martinez, Bagnell, for the record, Rosenberg, Bandari, Vice Chair Collison, myself, Kaiser, Johnson, Lopez, Kerr, White Holland, Hill. So the amendment fails. Is there another amendment? Yes,
Thank you, Madam Chairman.
thank you for your patience.
Good thing I'm not sensitive, guys. Jeez. This one is a little bit more straightforward, which I think will have less discussion. In the bill, it raises the age. So the bill currently is 3 to 5, certain set of vaccinations are allowed, 5 and older, another set of, or 7 and older, another set of vaccinations are allowed. Actually, I said that wrong. 3 to 7, 7 and older. What the amendment would do is just raise the age to 9, which is the existing age for the flu shot in pharmacies. And part of the reason for this, and it saved us time from offering an additional amendment, there's a lot of people who do not believe that a retail pharmacy is an appropriate venue for children to be vaccinated at all, because, you know, I got a pneumonia shot at a pharmacy recently, and some of you may be surprised. I didn't cry. I didn't like it, but I didn't cry. But having, you know, 4 little kids, I know they cry when they get their shots. And so not all pharmacies are capable of providing the equipment, you know, a table, privacy, and, you know, so in my opinion, and the opinion of some that have testified before us, it's not appropriate to have children getting vaccinated in the pharmacy. So this amendment is being offered to give voice to those who are opposed to this, and basically go back to what things were like before COVID, except it expands it to all other vaccinations. Before COVID, it was just the flu shot at this age. This allows it for all vaccinations for people that are 9 or older. And with that, I move the amendment.
The amendment has been moved by Delegate Kipke, second by Delegate Shilega. Is there a discussion? Delegate Gazzoni.
Thank you, Madam Chair. I just have a question. I just want to make sure that I'm clear.
Yes.
So we're at no vaccinations for anybody under 9.
Sorry.
Okay, go ahead.
This amendment means no vaccinations for any kids under 9.
That's right.
So you take out the 3 and the 7, everything is 9 and up.
Yes.
Okay, just wanted to clarity. Thank you.
All right. I have Delegate Lopez followed by Vice Chair Collison.
Sure. So I just want to address the argument that Delegate Kipke made about the perception that some pharmacies aren't the appropriate environment for such young children under 9 to go to a pharmacy for an immunization or a vaccination. And I would say, you know, to direct the committee back to things that were said both in oral testimony and in written testimony, 90% of Americans live within 3 miles of at least one pharmacy. And so you have options. If there's a pharmacy that the line is too long, if there's a pharmacy that doesn't have the right accoutrements or snack selection that you might pick up at the pharmacy, statistically speaking, people have more options. And so, you know, certainly there's pharmacies I would bring my children to, and other ones that logistically, you know, I might not like the parking lot or something, but you have options with pharmacies.
Delegate Collison.
Well, first, Delegate Kipke, I think you're a really sensitive guy in a good kind of way. So thank you. I would remind folks that we have that for a period of time, pharmacies were vaccinating all kids between 3 and 18. And there were no incidences. We asked the Department of Health to study the impact of having these vaccinations, and we asked them to make a recommendation. And you all got the report that they published last July, and I think they reported on in a briefing early this year. And their sentence in terms of whether or not children should be given vaccinations in pharmacies. They say MDH strongly recommends making permanent the authority for pharmacists to order and administer CDC recommended vaccinations to children ages and they said 3 to 18. This bill is a compromise bill that limits the vaccinations that can be given to 3-year-olds and between 3 and 7. And then at 7, the rest of the CDC recommended vaccinations. They did a very thorough study. They looked at exactly how many vaccinations were given in pharmacies and how many were given in non-pharmacies or doctor's offices. They're also very committed to the fact that pharmacists must try to connect a family if they do not have a medical home or a primary caregiver. They are responsible for helping to connect that family with a primary caregiver or a local health department. So I trust our MDH to be doing things that are right for children. And I think this is what they've said to us.
Okay, Delegate Hutchinson.
Thank you. Madam Vice Chair, just I need a clarification here. In this bill, what can occur between the age of 3 and 7?
In this bill, only the things that are that can go with the 3-year-old, which is it's through the COVID, flu, and if there's an emergency drug.
Okay, I thought there was an emergency provision. There
Right.
was like a health crisis or.
Right.
So in terms of the amendment, everything, Delegate Kipke, is 9 and above.
Yes.
Yes, that's correct. However, when there's a state of emergency, the feds act like they did with COVID, and they would make provisions for an emergency treatment.
Thank you.
All right. I'm gonna call on Delegate Johnson, followed by Morgan.
I just want to make sure this is still optional, correct? They can still take their kids to a pediatrician if they choose?
Yes,
Thank you.
to be fair, Delegate Morgan.
So I support the amendment because if you look at the study that was turned in, let me get to the top, the Health Occupation Pharmacist Administration Children Vaccine Study that was done in 2001. You look at all the vaccines that were given at non-pharmacies versus just the total vaccines given. And in every vaccine, it's higher in 2019, 18 and 19 than it is in 21 and 2022. And I think the reason for that is that when people go to their primary care, their pediatrician, the doctors are advising people to get vaccinated. And when you don't make those appointments, then children aren't getting vaccinated. My understanding is this amendment sets precedent back to what we were doing prior to COVID, when actually more children were getting vaccinated. I mean, the data is unrefutable. So my question is, how long was it that we had this policy where only pharmacists were giving the flu vaccine? From what I remember, it was maybe a decade.
I'm gonna allow, if I may, Delegate Morgan, my vice chair to answer, Delegate Collison.
So I can't tell you how long it was for flu. I mean, I think it was more like 7 years.
Okay.
Because I know, I feel pretty certain that it's happened in my tenure here. But a while back, not recently. So at least 7 years that 9 and above were getting the flu shot.
1 second,
And then we
Delegate.
changed it with COVID.
1 second,
Okay,
forgive me
thank
for
you.
interrupting, Delegate Lopez.
To respond on some of the data you shared, I'd like to remind the committee that the numbers that were shared were during the COVID pandemic. And so many pediatrics offices were closed during that time. And that was one of the drivers of the numbers being so low.
All right,
That could be.
thank you. Delegate Riley.
Thank you, Madam Chair.
You're welcome.
Yes, so I heard 2 comments one from the Vice Chair that mentioned, a big portion of the bill, and we heard it in testimony, was that the bill does require that the pharmacy gives the information to the patient, to say it with caregiver or parent, that they need to follow up with the physician, which in my mind kind of defeats the purpose of, going to the pharmacy because it's closer to your home or what have you, because it requires you to go to 2 visits. So now I have to go to the pharmacist to get the shot, and then I have to make the appointment to the doctor. Why don't we just encourage people just to go to the doctor? Then it's 1 visit opposed to 2. So that was.
Delegate Collison, would you like to answer?
Thank you, Madam Chair. We will always encourage families to take their children to a pediatrician. So no one is stopping that kind of encouragement. But we are also providing greater access for those who want to take advantage of that option. It may be that they're in a hurry and they've got to get, and the school year is looming and they can't get into their pediatrician. So they run into the pharmacy and they get the vaccinations that they need in order to go to school. It may be that they have a very busy schedule, as we all are very well aware of now. And they have a few moments to take their child into the pharmacy. It's really just about giving options and accessibility. And it's at some point a level of convenience, because as Delegate Lopez just pointed out, everyone lives within 2 to 3 miles of a pharmacy. So I think, we as a group, while we believe that children need a medical home, and we will do everything we can to help them get there. And if they don't have one, when they come into a pharmacy for a vaccination, the pharmacist is required to help them find one.
I just think you're kind of doing it backwards. So I think we need to know the medical history of a child, a 3-year-old, up to 9, before you're actually giving them a shot of any kind. And it's just best to go to the physician first and get the shot, and then maybe a follow-up, but without the history, I just think we're just doing it backwards. But my opinion and your opinion are different, so I get it. Thank you.
I'm going to call Delegate Taveras, followed by Shalega, followed by Rosenberg, followed by Johnson, followed by Bandari. Taveras.
Thank you, Madam Chair. The conversation's been as if pharmacies are not an adequate place to provide these services. And I just want to say that during COVID, even pharmacies were hard to reach because you had to call to set up an appointment. And for some folks who could not just sustain and be on the phone 24/7, even that became untenable. And we had to resort to vaccinating people in supermarkets, in open space in apartments, nightclubs, strip malls and parking lots. And so I think what looks sexy is relative. So, and what's appropriate in these pharmacies is relative. On average, with the population that I represent, oftentimes over 2,000 students come to the system unvaccinated, unready to enter the schools, and they have no access to insurance in order to go see a doctor. And the FQ, the Federal Qualified Health Centers, don't really have the capability to take them in. That's because they have limited resources. So for this to be a possibility, I say, why not? When the accessibility may be there now, the flexibility and the access due to proximity allows it. Therefore, it makes us all safer. Thank you.
Delegate Shalega.
I was looking on Dr. Google.
I think we all have used him today. He's going to be tired.
And because I recall conversation on the actual administration of vaccines to children, which is different than to adults. And that being one of the reasons that in the amendments, the age was upped. So I would say, although I couldn't find it readily on Dr. Google, that would be another reason to support Delegate Kipke's amendment, that, pediatricians are trained with children that are not adults.
Thank you, Delegate Shaliga. Thank you, Delegate Shaliga. Delegate Rosenberg.
Do we know good estimate the percentage of kids who do have a pediatrician versus those who don't? I mean, because the situation for these kids in terms of vaccinations, in terms of the issue here and where do they go is vastly different if you don't have a pediatrician. Do we have a sense of that? Because I think that's important to know how many kids out there need this option.
So Delegate Lopez wants to reply to you. Delegate Lopez, thank you, Delegate Rosenberg.
Sure. So in a report that MDH put together that's been referenced already, it's 48.5% of children in our state have a medical home, like a pediatrician who serves as a primary care physician. So just a little under half.
May I
Yes.
follow up? What difference does it make in terms of vaccinations?
It's the same vaccination that's given in a pharmacy or a pediatrics office.
But in terms of your access, if you
Um,
don't have a pediatrician?
I don't have a statistic that speaks to that.
But you're asking, if I may, what difference does it make to not have a doctor? Well, the difference is that if you allow them to get vaccinated and the drugstores are in the neighborhoods, right? At the corner, especially in communities of color, they lack transportation, right? It just makes a big difference because it's a matter of convenience.
Thank you.
All right, Delegate Collison.
First, I want to respond to the question about the doctors. That 7-year-old and the age limit, the 7 years was a compromise with the doctors, with MedChi, with putting that 7-year-old in there. It became they were not opposed to the bill. But in terms of responding to the issue of what difference does it make? Please forgive me because I'm going to read again from the report. This is from MDH that says, given the overall benefit of illness prevention, the documentation that vaccinations are one of the most effective public health tools available, and the recognition that lack of easy access to preventive services like vaccination increases health inequities and increases health inequities. I'll stop there. The rest of it just goes on. They should continue to be delivered by pharmacists. So that I think is what makes the difference. If they don't have a primary medical home, they're at risk. They're more at risk for health issues than they are when they are vaccinated.
Okay. I have next Delegate Johnson, followed by Bandari, and then Bagnell.
Thank you, Madam Chair. And just submit an answer to a question that was asked earlier. As per the Public Readiness and Emergency Preparedness Act, pharmacies have been able to give vaccines since 2006.
Okay, thank you for that answer. Next, we have Delegate Bandari.
Thank you, Madam Chair. I mean, the amendment looks great. I mean, it envisions the continuity of care and immediate access to medical care.
Mm-hmm.
However, the amendment poses some challenges, like Vice Chair Coalition said, and a lot of parents don't have reliable transportation, working parents, and the cost for some, especially those without insurance or with high deductible plan, the cost of vaccination at a doctor office can be higher. And we all know that wait times, depending on the healthcare provider's availability, scheduling vaccination can involve very, very long times as well.
Delegate Bagnell.
Thank you, Madam Chair, and I really appreciate this discussion. You know, a lot of times I look at these through the lens of our crisis intervention team in Anne Arundel County. They speak to the wheel of access and that there is no wrong access point. And I think when we're looking at the question of why the pharmacy and not the physician first, I think it's a yes and. It's not an either or. It's is this the access point where they're going to get their vaccinations and then get a pediatric home? And I think it's all part of the continuity of our healthcare system. And this is just creating, actually codifying an established access point that has been very successful. And so for that reason, I support the bill as originally amended.
Any further discussion on this amendment? All right. Seeing none, all those in favor of the amendment, please raise your hand. Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Hipkey. All right. And then everyone else who's not actually, just raise your hand if you're in support for the record. And support, no, not support, against the amendment.
Opposed to the amendment, right? Right.
Opposed to the amendment, guys, opposed to the amendment. It's a long night. Thank you for correcting me. Yeah, Delegate Gazzoni, Delegate Lewis, Delegate Woods, Delegate Martinez, Delegate Bagnell, Delegate Olston, Delegate Bandari. Rosenberg, are you opposed to the amendment? Rosenberg, it's okay. Collison, Peña Milnick, Kaiser, Taveras, Johnson. Yes. Lopez, Kurt, thank you. White Holland and Hill. Okay, everyone else. Because everyone is present for the record. Okay, we have all 23 members here today. Yes.
Getting another amendment. You're gonna love this one. This amendment's a little different, but it addresses some of the concerns that have been brought up as it relates to the workforce issues within pharmacy. In fact, we have had some pharmacists who work in national retail chains complain about this. So what this amendment would do is add a pharmacist may not receive compensation or benefits in return for administering vaccinations to individuals under the age of 18 years old according to a quota. So they can be reimbursed, the pharmacy can be reimbursed, but the pharmacist's income cannot be tied to hitting certain quotas within the pharmacy. I move the amendment.
It's been moved by Delegate Kipke. It's been seconded by Delegate Morgan. I'm going to open it up for discussion now. Are there any comments or concerns about this amendment? Vice Chair Collison.
Thank you, Madam Chair. Again, I would ask the body to resist this amendment for a very different kind of reason. And because we all know the role that PBMs play in pharmaceutical or pharmacy reimbursements. The language as it stands in this amendment would literally allow a PBM to not pay the pharmacist for the vaccination. Because if the CVS sets a quota, then and tells their pharmacist, you have to do this, but you're not going to get reimbursed for it, or you won't get there's actually a little what do they call it? There's a vaccine administration fee that the pharmacist gets. So this amendment would actually prohibit them from getting it. Setting quotas in pharmacies is a problem, but it doesn't have a role in this bill. This bill speaks to getting the children the vaccinations they need to stay healthy. So I would ask you to resist the amendment.
Delegate Woods.
I'll try. Whole compensation piece
And I think you made, so a pharmacist, I'm trying to understand this whole quota thing, right? And compensation. So my assumption is that the pharmacist gets what the pharmacist gets. It's not like a pharmacist can say, well, I'm going to do these and I'm going to get paid extra money. I understand there's a fee, right? I'm trying to be clear in understanding the pharmacy benefit manager's input.
So for example, in the chain drugstores, may I, Madam Chair?
Yes.
I'm sorry. In the chain drugstores, they are affiliated with PBMs.
Correct.
And the PBMs are the ones that are deciding, you know, how much to reimburse for things. If it doesn't say, for example, if CVS were to set a quota saying to the pharmacist, you have to do 100 vaccinations a day. And then, but under this bill, they wouldn't have to pay that administration fee to the pharmacist, because it says they may not be compensated if there is a quota. So that's what it means.
And then Madam Chair.
Yes.
I'm trying to understand, like, how do you set a quota for vaccinations? How do they possibly know how many people are going to be coming to their pharmacy?
That's what our pharmacists are in the trained drugstores are telling us now, that,
Yeah, I mean, how would you possibly
their
know?
employers are setting these quotas because they want to get kids into the pharmacies.
Okay, okay.
Delegate Olson, followed by Shalega.
I guess I'm gonna follow up on that question, because my concern is we ought not be setting quotas for how many kids are being, like, I
Right.
think, yeah, so is that?
If I recall the testimony, they said that they were not setting quota. I mean, that is what they said when they came here. Now, there are allegations that they are setting it. I don't know where the truth lies, right? And that is we don't know whether we don't know, right? But they're
Okay.
saying that the pharmacist is saying, no, that is not true. And when we met with some of the witnesses, they said that was happening. So for the record, that is what we had when they testified here. Okay? Now, what Delegate Collison is saying is that if this amendment goes through, then they're not able to get the fee they would otherwise get for doing the job, right? The work.
Right, I don't have a problem with them getting paid for the work that they do, but I do have a problem if PBMs are setting quotas saying vaccinate X number of kids per month, per day. I just think that we should not be allowing that to happen.
I wouldn't, may I?
Yes.
I don't disagree with you. I just don't think it belongs in this bill.
Okay.
Okay. Delegate Shalega. Go
Thank
ahead.
To Delegate Kipke, aren't they doing this in California and maybe a couple other states?
Delegate Kipke.
Thank you, Madam Chairman. So other states have already banned this, and I can see the light ahead of me. I sometimes can see it as a light at the end of the tunnel, or sometimes there's a train coming at me. So I have a sense that there's a train headed this way on this amendment. So maybe there's a bill that we can introduce next year, but this amendment does not prohibit a pharmacy from being reimbursed for administering a vaccination at all. What it does is here are the words, pharmacy, that gets reimbursed. It prevents a pharmacist from being held to quotas for the purpose of a bonus, so that's the purpose of the amendment, and other states have already taken action to ban this. And it's all around the workforce issue. If you've been in a pharmacy lately, most people, I think, would agree that it's a tough work environment, and so tying pharmacists, bonuses or to something like this has shown to be a problem in places, and that's what the amendment seeks to remedy.
Thank you.
Thank you. Delegate Johnson, the pharmacist in the House.
Oh, pharmacy, excellent.
Pharmacy owner.
And just for some clarity, we did hear about quotas for vaccines and prescriptions. So I did have a adequate anti-quotas and adequate staffing bill in that I withdrew this year because it wasn't ready. And I did have a stakeholder meeting. And the ones that we were hearing were setting the quotas did not show up for the stakeholder meeting. So just to let you know.
So the bill will come next year.
The bill, well, if we get it ready and we could get some evidence of this happening, it will be coming next year.
All right. Delegate Kaiser.
Thank you, Madam Chair. I want, my question for the amendment proffer is, how would we know if they were setting quotas? How would this be implementable? I'm sorry, making up a lot of words.
So, I have to get back to you on that. I mean, if it's illegal in the code, I suspect that it could be brought up through employment law, because it isn't, in my research, it isn't the PBMs who are creating the quotas. It's the employer. It's like, I don't want to name any names, but it's national companies that say to their employees, if we're going to lower your salary by 10%, but we'll give you 15% back in a bonus if you hit these numbers, and they create those types of goals, those sort of sales goals. So hopefully that answers your question.
Okay, Delegate Lopez.
Thank you, Madam Chair. Well, Delegate Johnson kind of beat me to the punch, but I wanted to offer my hand to Delegate Kipke to be your bipartisan co-sponsor of a bill to address these workforce issues. Because I agree there's probably work to be done there. But I just respectfully disagree to the amendments because I think they are outside of the scope of the bill.
Vice Chair Collison.
Just real quickly, in terms of the way I understand the intent and absolutely agree, and I'll sign on to that bill as well. Next year when we address quotas, but just the language of this amendment, which says they may not receive the compensation in return for administering vaccinations according to a quota. So if there was an arbitrary quota, they could still do the vaccination, but they couldn't receive the benefits in return for administering them, just under the language of this amendment.
Okay. Delegate Woods.
Just out of curiosity, I don't even know if anybody can here answer this question. Do we anticipate that somehow pharmacies or companies are going to be doing this great advertising that these vaccinations are available?
They do.
Okay, so they're going to actually be trying to pull people in to get the vaccinations very intentionally. Okay.
All right. Any other questions or concerns? Oh, Delegate Olson.
So I get the sense that we don't want to mess with this bill as it is. But I do want to just say that I have a real concern that it's a possibility we could be saying to these national PBMs that it's okay for them to implement quotas on how many kids get vaccinated. And I'm just wondering if we could just say in this bill that you cannot do that.
But if I may?
Yes.
If you say that, you are assuming that you know for a fact that it's taken place.
Okay.
We here vet everything. And the way to do it intelligently is to bring everyone to the table and find out where is it taking place, first of all? Where is it taking place? To what extent? And who is doing it so that you can have the appropriate policy to be intentional and be laser focused.
Okay.
Okay.
All right. Thank you.
No, great point. Thank you. Yes.
The amendment.
Thank you. And we know that Delegate Johnson and you will work on this next session. Okay? And Alston. And Lewis and Alston, how's that? And Lopez. Actually, you know what? It's a good, no, on all seriousness, it's a good exercise for the interim for you guys to put together. We already have, Michelle has a little work group sheet like we did last year. We had 7 that a lot of you participated and a lot of the bills came out of that. I think that would be a great, Michelle, added to the work group list and you guys are gonna lead it, okay? Thank you, Delegate. I appreciate it. So the third amendment has been withdrawn. Any further amendments on this bill or discussion or concerns? This is the place. All right, seeing none on the bill as amended.
Move the bill as amended.
The bill has been moved and second. Any questions or concern on the bill as amended? Seeing none, all those in favor say aye.
Aye.
Any opposition to the bill, can you raise your hand? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. Party line, okay? We are done with the bills, but I like